My name is Dr. Tina Satarangani, and I'm honored to share a project that's very close to my heart, one that sits at the intersection of technology, nutrition, and community-based care. For many people, when they think about adult day centers, they imagine dancing, dominoes, or bingo, places where adults go to socialize. And yes, joy and connection are part of the story. But what most people don't realize is that for 1 in 5 participants, the meal they receive at the center is the only full meal they'll have that day. That meal isn't just a moment of nutrition, it's a lifeline. It's medication management, chronic disease control, and social connection all rolled into one plate. It's what keeps frail older adults, especially those living with dementia, stable and able to remain in the community rather than entering long term care. Here's the problem we're trying to solve. We know that up to half of older adults in long term care settings are malnourished, and that malnutrition, especially among people living with dementia, is one of the strongest predictors of decline. And yet, our system continues to rely on one size fits all meals that ignore individual nutritional needs, chronic conditions, and wellness goals. It's not that providers don't care, it's that the tools simply don't exist. This generic model of nutrition not only limits the health impact of programs like Adult Day, but it's also a poor return on taxpayer investments into government funded nutrition programs. Adult day centers are filled with caring, dedicated staff, but most lack access to registered dietitians or evidence based nutrition tools. Traditional methods like food recall or plate weighing are time intensive and nearly impossible to use for clients with memory loss. So we have a real gap, not in compassion, but in capacity. A gap between what we know nutrition can do and what's actually possible in low resource community settings. But that also means we have a tremendous opportunity to use technology to modernize, individualize, and truly optimize mealtime care. This brings us to our solution, tailored nutrition, precision nutrition powered by AI. Our system uses image-based recognition to analyze meal photos, identify foods and portion sizes, and estimate nutrient intake automatically. Then it translates that data into personalized recommendations tailored to each participant's health profile, seamlessly integrated into the CareMobi platform that adult day centers already use. So instead of a one size fits all menu, staff will have access to real time, actionable insights, enabling them to make small adjustments that have big impacts on health outcomes. This isn't technology for technology's sake. It's about bringing dignity, equity, and precision to one of the most fundamental aspects of care, nutrition. Our work in this project is organized into three aims: develop and refine the image based nutrient recognition model so that it accurately identifies food items and portion sizes, validate its clinical impact, ensuring that AI generated data actually improves nutritional care decisions, and integrate and pilot the tool directly into adult day workflows through CareMobi, making sure it's not only effective, but easy and intuitive to use. This is about moving from abstract innovation to practical transformation in real world care environments. This project is powered by a multidisciplinary team, engineers, nurses, dietitians, and public health professionals, all deeply committed to improving community based care. Dr. Oded Nove is expert in developing AI driven technology for low resource settings. Dr. Jeanette Beasley, a dietitian scientist, ensures nutritional accuracy and clinical rigor. Our dedicated and experienced project manager, Sharzad, manages implementation and integration, and I bring a deep expertise in designing technology alongside adult day center staff to address pressing problems and focus on usability, workflow, and human centered design. Together, we're ensuring this technology is both scientifically rigorous and practically deliverable. We're currently finalizing our minimally viable product or MVP, integrating the recommendation engine directly with CareMobi. Next, we'll pilot test the system in real adult day centers to measure accuracy, usability, and clinical value, comparing its performance to registered dietitian and refining it based on feedback. Our goal isn't just to build a tool, but to build trust and adoption, ensuring this fits seamlessly into daily routines, not disrupt them. Here's a snapshot of our 12-month timeline, from model development and wireframing to MVP deployment to real-world data collection and analysis. Each milestone will move us closer to making precision nutrition accessible in every adult day center. Before I close, I want to express my sincere gratitude to the Penn Artificial Intelligence and Technology Collaboratory and to the National Institute on Aging at the NIH for their generous support. Your investment makes it possible to bridge the gap between research and practice and to ensure that every meal served in adult day centers can be smarter, safer, and more nourishing.